Hey, this is Dr. Mauldin. Yes, you can see it looks like I'm on this fabulous beach, but I'm not. I'm in my office, but this looks better than looking at the wall behind me. So I wanted to do this video this morning because some of the conversations that I've had over the past few days, it's really sad. And I really want to talk about neuropathy because I don't think that people really understand how serious it is. And when you start losing sensation from your feet and your hands, your brain slowly withdraws, and the map in the brain loses the pinpoint sensitivity. And what that means is that your brain has this map inside. It's like if you ever saw the surgeries where they open the brain surgery, where they poke in the brain and the hand moves. It's because inside of that map is called something called the homunculus. You can look it up online. And what that is, it shows exactly where things are mapped out. And what happens is your brain, once it's losing the sensation from your feet or your hands in the brain, your brain thinks that your hands and your feet are no longer there. Now, that's a big problem. So if you go to reach for something, let's say, and you miss it or you lose that specificity, like you're maybe 1 centimeter off. It doesn't seem like a lot, but it is, because that tells you how much your brain is deteriorating. And why is it important with your feet? Your feet are even more important because if you're walking down the street and you hit just a tile on the street or something, or the pavement has a hole, your foot turns like this, your brain doesn't know where your feet are. And so that is what leads to falls. And it's scary. And people say, oh, if they're walking in the house and they trip, they say, oh, it was the rug or it was the table or it was this. No, that is not it. That is your brain telling you that it does not work well with your feet anymore, and your brain does not know where your feet are. This is a huge problem because if you've lost that connection, your nerves are not working properly, you're not getting the blood flow to the nerves. What will happen if you fall? Okay, let's say you've had neuropathy for, it doesn't even matter how long it is, because if you've lost the fundamental, the foundation of what a body needs to heal, meaning getting blood flow, getting the proper nerve function, getting the right oxygen, everything, the nutrients sent to a bone. Let's say you fall, you break a bone. If you break a bone, if you don't have what it takes to put that back in order, how long do you think it's going to take to heal? I'm sure you've heard of people, things get gangrene and the toes just turn black. I talked to a lady the other day. She told me that one toe turned black and then another toe turned black. Her entire foot turned black and she had to have it amputated from the toes first, then the ankle, then eventually it got to the knee. Can I tell you, it scares me to death. I don't know what it takes for people to understand, like, how much, what's the price that you put on a toe? I don't know. 1,000? I don't know. What price do you put on a foot? 10,000? What price do you put on a leg? 100,000? I don't know, but I really want to keep what I have and take care of the body that I have. And I don't know what it takes for people to understand that when those red lights are going off, the alarm is telling you something is wrong. It is not normal to have pain in your feet. It's not normal to have tingling or numbness in your hands and your feet. It is not normal to lose your balance. It's just not normal. Please do not discount it. I cannot stress this enough. I'm so passionate about this because I see people now who are desperate and they have tried everything and nothing has worked. Now, why is this a problem for me? Because these people are seeing all of these, and maybe you are seeing all of these ads online for neuropathy. Oh, I can help you take this supplement, do this machine, but they're not helping you get to the bottom of it. And that's the problem, because you can't, sugarcoat it, so to speak. And that's probably not a good word for diabetes, or maybe it is, but you have to get real about this. Like, ask yourself, are you truly taking care of your body? Are you healthy? Do you take care of yourself? Do you eat to live, or you live to eat? I mean, at what point do you just say enough is enough and you'll do whatever it takes to get better? I cannot help everyone. I have tried. And when somebody is so excited for you, or you're so excited for somebody else, but they're so depressed or they're so lost and they have no hope, and they just do not want to do anything. They just sit in the corner and they waste away. I don't want you to be that person. I want you to get back out there and live your lives, not be on the sidelines and just observing other people. That is sad. It really is sad. Like, if I don't know if you have a hobby that you like. I don't know if you have grandchildren that you want to play with, or even children. This doesn't necessarily affect the elderly. It does get worse as you get older, but what will it take for you to do something? I don't do my program just saying, hey, take this supplement and hope that it helps, or use this machine. I want to help you to improve your overall health. And how can I do that? I can do that as your coach, because I can help you combine the things that are actually not correct, and help you to put in the good things that can help to balance it out. And once your body gets the right fuel, the right nutrition, then your body can start to heal and start to work properly. And then you will have less falls. You will have more sensation in your feet, and you will feel better because you'll have less brain fog, because we'll help to remove the inflammation. So I'm very passionate about this, and I want to help people. I really want to help you. I know that I can't help everyone. And I know that a lot of you, and I may be talking to you, a lot of you have absolutely lost your drive and your passion for everything. And you've just kind of said that this is your lot in life and this is the end. It does not have to be that way. Now, with that said, like the lady I talked to the other day, obviously I cannot bring back a leg that's been cut off. I can't bring back a toe that's been cut off. But what I can do is help you improve what you still have, so that you don't lose the rest of it. I mean, I don't know what to say about it. The other thing I will say is, the machines that I do recommend, they're not cheap. I'm not going to lie. They're not cheap, but they are the best on the market, and there is no substitute. I have tried, I've looked in China, I have looked high and low to try to find the absolute Cadillac of neuropathy machines, and I've found them, and they work. I've seen them work time and time again for every single patient that I've put on my program that listened to what I told them to do. If that is you, then we can work together. I cannot give things away. At some point, I would really like to have some charity cases to people who can't afford it, because I am truly in this to help people. I will do everything that I can to help you, but I cannot do it alone. It takes two, and sometimes it takes more than that. Sometimes people have to ask their family or friends for help because they need it. And I can tell you this, if you go to your insurance will not pay to keep you healthy. They will only fix you on the basic level if you fall apart. So if something happens, you go to the hospital, they might do some tests and give you a drug and out the door. But they're not going to educate you and tell you what you need to do to keep your body healthy. So that's enough of a lecture today. I just wanted to touch on that. I don't even know if these lectures help anybody or not, or who even watches them, but I felt like I needed to put that message out today. So I hope you have a good day. And if you want to work with me, I'm here for you. If not, I hope you find the right person to work with you to get a resolution with your neuropathy. One last thing I will say is I've had some people say, oh, you're in North Carolina. I live in Oregon, or I live in Illinois, or I live in Texas. It doesn't matter where you live. We have to look at what's wrong on the inside. All of these symptoms that you're having are an exterior manifestation of what's going on the inside. I don't really need to see you. If we fix what's going on the inside, then we can help what's going on the outside. So don't let my location limit you to where you feel like you have to go to somebody local. Maybe there's nobody where you are, and that's why you're not getting the results. And you can keep looking, but they're not there. They're just not doing this. I can tell you. So anyway, that's enough. Have a good day. Bye.